Welcome to this recorded presentation about clinical evaluation of the peripheral arterial tree. I'm Dr. Ali Sabbour, Professor of Vascular Surgery, Ain Shams Medical School, Cairo, Egypt. This presentation targets Year 2 medical students studying their integrated cardiovascular system module. The presentation is introduced in 4 parts and is an introduction that will help you to engage actively in your clinical ward session. Your reference clinical book is Browse Introduction to the Symptoms and Signs of Surgical Disease. Please refer as well to the study guide document sent by email to all of you. By the end of the 4 presentations, you should be able to explain how gradual narrowing or occlusion of an atherosclerotic artery will cause different clinical presentations of chronic ischemia, and you will be able to describe different clinical signs in a patient with chronic ischemia and how to elicit these signs. By this, you will be ready to engage actively in a coached ward session to take medical history and elicit clinical signs from a patient with suspected chronic ischemia. Among the different diseases that affects the arteries, atherosclerosis is the most common underlying disease. The effect on the diseased arteries commonly takes the form of gradual stenosis that may be followed by occlusion, or, less commonly, weakening of the arterial wall followed by arterial dilatation, what we call an aneurysm. In the following presentation, we will talk only about atherosclerotic occlusive disease. There are several conditions and diseases that renders an individual more prone to develop atherosclerosis. Smoking, diabetes mellitus, and dyslipidemia are on the top of the list. It is important to identify these risk factors in a patient with suspected peripheral arterial disease. You should ask the patient about them. That's for 2 reasons: to support the etiology of your diagnosis and to consider control of these risk factors in your management plan. How would atherosclerosis affect arteries? Atherosclerosis affects arteries by gradual deposition of cholesterol within the arterial wall, forming what is called an atherosclerotic plaque. The plaque will cause gradual arterial lumen narrowing, causing arterial stenosis or occlusion. Please refer to the biochemistry and pathology lectures for more details of plaque formation. The picture shows a transverse section in an atherosclerotic artery with a stable plaque. Note how is it causing lumen narrowing. Plaque necrosis, hemorrhage, or ulceration, all of which describes what we call a complicated plaque, will eventually result in further luminal narrowing or thrombosis. The picture is a cut section of a diseased artery showing how a plaque complicated by necrosis and hemorrhage, as you can see here, can cause narrowing of the arterial lumen that may mount to thrombosis. The plaque can rupture as well into the arterial lumen. The exposed thrombogenic surface can result in acute thrombosis of the arterial lumen. Here you can see the thrombus that forms within the lumen because of the ulceration of the plaque content and exposure of the circulation to this thrombogenic surface. As the artery becomes narrowed or occluded, the distal blood flow is reduced. The pathological condition that results from decreased blood flow to an organ, in our situation here the lower limb, this is called ischemia. Sudden occlusion of an artery will result in acute ischemia. You already studied a prototype in your general pathology course that is the example of acute arterial embolism. Gradual occlusion, on the other hand, of an artery will allow opening of pre-existing collaterals and the formation of new collaterals. The presence of collaterals explains some of the main differences between the clinical presentation and the clinical outcome of acute ischemia compared to chronic ischemia. So, gradual narrowing of the arterial lumen will stimulate opening of collateral arteries. These collaterals will try to compensate for the decreased blood flow. The extent of collateral development will determine the degree of ischemia. This concept will be elaborated more during your clinical session. These are two examples of normally existing collaterals around the knee and around the elbow. These collaterals can partially compensate for occlusion of the popliteal and the brachial arteries when it happens. You will find more details about important collaterals in your anatomy course. In this presentation, we will focus on the clinical presentation of chronic ischemia. Now, how would a patient with occluded lower limb arteries present clinically? This will be the topic of the second presentation of this series. Thank you.